one of the biggest issues, especially from a Movember sense, is there's a lack of a gendered lens to these types of prevention programs. So veterans and first responders are, mostly male. Within the ambulance community in a lot of these countries, they are more 50-50, a good gender balance now, but the majority of the senior management are still male, and the workplace culture is a very masculinist culture. So we are still dealing with, very much a men's health, issue in some respects. And the programs were gender blind coming in. So they really didn't take into the fact that, men may approach these types of programs differently. They may interact with these programs differently. There may be no reinforcement for actually, engaging in the tools or using the tools that they're trying to get these people to teach. So there needs to be a more of a gendered approach that basically adopts more of a positive psychology lens, promoting these things, these types of skills or interventions, in a way that is the way that speaks to men and enhances their likelihood of sticking with the program and engaging with what it is you're trying to teach them. So based on all of that, Movember came back and said, wow, this is not something that we thought we thought we were going to get Don to tell us which programs work best, but instead he's told us nothing really works. So in 2020, they issued 2 requests for proposals for researchers to come back to them with programs that they think are promising, but they don't have any evidence for, and they want to actually test the evidence. They wanted these programs to be have to apply a gendered lens, so to maximize them for men. They wanted them to be evaluated effectively, so they brought in a third-party evaluation team, to come in and help these people do this. And and so they ended up having these 2 requests for proposals. We had a grant review round this year, and they recently announced that there are 15 proposals that they're funding over the next 2 years in 8 countries. So myself, I'm working with a colleague, Steve Robertson, in the UK to work with the teams to maximize the gender lens element. So I think there hopefully, over the next 2 years, these teams will be able to at least tell us a little bit more about what works and what doesn't. I'm hopeful that it does work, but but science is really all about finding what doesn't work too.